In the U.S., medical treatment is escalating with no improved outcome. Much of this is due to overtreatment, expensive tests and procedures that are done without benefits.
Studies show that if patients understand actual risks and benefits of treatment, overtreatment and costs are reduced while patient satisfaction is increased. I'm Andy Lazris. I'm a primary care physician.
I'm Rifkin, an expert in human health risk assessment.
Our recent book provides a practical guide that helps doctors and patients discuss multiple medical interventions using a familiar format, a theater, that illustrates health benefits and risks and empowers patients to make good decisions. We call this a BRCT, Benefit Risk Characterization Theater.
Let's use breast cancer screening to illustrate how this approach would work. It is typically reported that mammograms reduce breast cancer risks by 20%. That's a relative number. Let's look at the actual numbers. Independent studies have shown that among 1,000 women screened over a lifetime with mammograms, one will avert breast cancer death. Out of those 1,000 women, 64 will have unnecessary biopsies. BRCTs help patients make informed decisions by showing actual benefits and risks.
Let's look at a case that is relevant to insurance companies right now. There is a new test for lung cancer screening in smokers that is so expensive that Medicare mandates doctors and patients discuss it before ordering the test, but there is no language for that discussion. Doctors typically cite a relative risk reduction of 20% in smokers who get CAT scans, but let's look at the real numbers. Even after 5 years of annual CAT scans, approximately 3 people out of 1,000 will benefit, while over 200 healthy people will have repeated abnormal testing that leads to potentially dangerous and costly additional tests and procedures. When heart stents are placed in blocked arteries of 1,000 people, studies show no benefit compared to the use of medicines, while over 20 people will have life-threatening complications. Currently, only 3% of cardiologists fully discuss the procedure with their patients, and when they did discuss the procedure accurately, virtually none of their patients chose to get stents. But when they simply recommended stents without a discussion, virtually all of their patients chose to get stents. By reducing the number of procedures, we could potentially save the system billions of dollars.
Our book applies this method to a variety of medical decisions that doctors and patients should make together.
We've conducted focus groups and used BRCTs in actual clinical settings. They empower patients and reduce overtreatment.
For a copy of our book or consultation, visit our website.